of integration. To avoid that integration, the best approach is a holistic approach to have a system that is designed on one platform. And I emphasize this point, especially from the point of view that there are a lot of companies out there that offer all these three different modules or three different systems, but they might not necessarily be built or designed on the same architecture or the same platform. And therefore, it is very important to look for that when you're looking to choose your vendor, that whether it is actually and literally seamlessly integrated. Once an electronic health record is in place, it will ultimately provide an automated and streamlined workflow, allowing the user or the practice comprehensive and meticulous monitoring of patient activity from the time the patient checks in to the time the patient checks out and beyond. So in other words, administrative, financial, and clinical points of view should be automated and streamlined. Of course, this also necessitates that there is a learning curve involved in understanding what the SequelMed EHR is, and that is what you will see in the design of our system, that we have tried to very simply simulate the process of electronic chart or a manual chart onto an electronic format. Some of these benefits, before going into the application, the returns on investment, why should we really use or adapt to SequelMed EHR or electronic health records in general? And for that, the next slide is basically titled Workflow Optimization and Improvements. What happens is that if this is implemented, or when this is implemented in its optimal form, there will be workflow optimization. Keep in mind again that after that learning curve is overcome, because we are doing something that has been different than what has been practiced for a long time. So these workflow optimizations and improvements are significant. Comprehensive health records management, your complete health record is accessible in an electronic format. And this, from a practical point of view, if you are a physician, if you need to access records remotely, rather than, sometimes a patient calling and saying a little bit later or off hours, and saying that, and you might have to respond to the patient that I don't have access to your patient record, so call my office tomorrow and I will be able to look at your chart. A health record, an electronic health record, eliminates that, and it allows you the possibility of looking at a patient record at any given moment. So remote access is a very significant aspect of electronic health record adoption. It also then facilitates, it's sort of a drill down effect that once you have a complete health records management, you have a comprehensive lab and pharmacy, prescription and medication management. And each one of these different factors, you will shortly see the specific benefits of it. Workflow tasking and communication, patient administrative and financial. You'll be able to ultimately do outcome, status, and quality measures reporting. Health maintenance and disease management protocols that are built in the electronic health records that also facilitate those kinds of reporting, as well as educational material that you might want to give to patients. A lot of times we want to give patients, as they're walking out, material for their own benefit, and health directives based on those protocols that might be applied based on either disease, a diabetic protocol, or vaccinations or immunizations that you might want to give to different patients. This is what ultimately leads to CCR, or what is known as CCR, or continuity of care record, as well as the core pay for performance. Just to give a brief introduction or brief synopsis of continuity of care record, the core element of EHR has always been to provide continuity of care by ensuring that a provider has relevant information of the patient's history in order to base decisions on such information as allergies, medications, previous diagnosis, etc. So whenever a patient leaves a hospital or a practice, or is referred by the primary physician to any specialist, or is transferred from one provider to another, the relevant information should be sent to authorized professionals through a continuity of care record, which is the same thing as EHR. So that's what it really facilitates. And technically speaking, the standard of CCR is usually technologically neutral. This means that an EHR or CCR can be printed out or transported by a patient or any other authorized person, sent as on a standard HL7 message or as an XML message to be integrated into the patient information system. And SequelMed EHR is something that is a system that facilitates that kind of protocol. Our system, in addition, also facilitates pay for performance. Given its robust and flexible architecture and ability to report on data elements at a granular level, it is also designed to account for multiple level reporting, including payers, patients, age groups, comorbidities, procedures, and diagnoses to facilitate clinical complexity of a patient population and account for differences, for example, in severity of illness and risk of mortality. And pay for performance is a very hot issue